told that you need surgery for an ovarian cyst can feel a bit scary. Well, I'm Brooke. I'm an obstetrics and gynecology doctor and I'm regularly involved in these types of surgery, and I'm here to help answer all of those questions that you probably forgot to ask in your appointment. So if you've been told that you need an ovarian cystectomy, you may be feeling a mix of emotions. You could be having pelvic pain, or you maybe had a scan that showed a cyst, or you're just trying to understand what all of this means together. Well, in this video, I'm going to take you through everything that you need to know before an ovarian cystectomy. So we'll talk about what it is, why it might be recommended, what different types of surgery that there are, from keyhole or robotic surgery, and we'll also talk about what recovery looks like. I'll also be tackling some of the common questions along the way. So first up, what is an ovarian cystectomy and why might it be recommended? Most ovarian cysts are benign. That means that they're not cancerous. In fact, functional cysts are common and they often go away on their own. But a dermoid cyst is another type of benign cyst that can actually grow teeth and hair despite it being placed on the ovary. So an ovarian cystectomy is a surgical procedure that is done to remove a cyst from the ovary without removing the ovary itself. It's often offered to you if a cyst is causing you symptoms like pain, bloating or pressure, or if it's a particularly large cyst, if it's persistent, or if it looks unusual on a scan. Sometimes surgery is the safest or the most effective option, especially if your cyst is large, that's bigger than 5 centimetres, if it's causing you significant symptoms, if it hasn't gone away and we've given it a few menstrual cycles, if it's found in someone who's postmenopausal, we're maybe more likely to recommend removal, or if it does have any suspicious features, so we think it could be problematic. Also, large, heavy cysts, like dermoid cysts, can actually weigh the ovary down and cause it to twist on itself, something called ovarian torsion, which can threaten the blood supply to the ovary, and that's risky. So those are all reasons why we may not leave the cyst inside, and we may recommend removal. So if a cyst is large, if it's heavy, or if it's concerning, we may recommend removal. The aim of the surgery is to remove just the cyst and preserve as much healthy ovarian tissue as possible. That's especially important if you are hoping to get pregnant in the future. So, can an ovarian cyst be removed without removing the ovary? Well, yes, that's the goal of an ovarian cystectomy. Unless your cyst has completely taken over the whole ovary, or if there's another reason the ovary can't be saved, like for example if it bleeds heavily during the surgery and that bleeding can't be stopped. Otherwise, surgeons would aim to remove just the cyst and leave the ovary intact, and that helps preserve your hormonal function and your fertility. Can you heal an ovarian cyst naturally without needing surgery? Well, as a gynecology surgeon, it might surprise you to know that no, I do not always recommend surgery. The answer is sometimes yes, but it depends on what type of ovarian cyst you have. Most ovarian cysts are what we call functional cysts. These are very common, and these cysts form as part of your normal menstrual cycle, like when a follicle grows, it releases an egg, and then that follicle doesn't dissolve straight away. Now the good news is that functional cyst, which was left behind, often goes away on its own within a few weeks to even a couple of months, especially if they're small and they're not causing you any symptoms. So usually with those types of cysts, we recommend a watch and wait approach, where we might repeat the ultrasound scan a few months later, make sure that it's shrinking. Now, you might read about lots of food or supplements that people recommend to dissolve an ovarian cyst. There's claims on TikTok like castor oil, putting it on a panty liner could cure it. Well, the truth is there's no evidence of any of that. In fact, what might happen is you see a cyst on a scan, you could start using these tricks like castor oil, you might go back for another scan and find that it's gone and say, yes, the castor oil cured my cyst, when actually it may have been a functional cyst that was going to go away on its own. But as far as I'm concerned, if you want to try alternative treatments like certain foods and oils, that's fine. It may not work to shrink a cyst, but as long as you aren't putting that particular food or oils in your underwear and what you're consuming is safe, then try what you like. It may not be the reason that the cyst shrinks, but it may well go away on its own anyway. Now, you also might have heard about draining a cyst. Well, this can be done, but it's not commonly recommended. And that's because cysts that are filled with fluid that we drain often later refill when the fluid collects again. So in most cases, if a cyst needs to be removed, it's better to do a cystectomy where the whole cyst and the cyst wall is taken out properly. Another thing that people ask me about is whether the combined oral contraceptive pill can actually shrink ovarian cysts. Well, again, the answer is not really. The pill can help prevent new functional cysts from forming, especially in people who are prone to them, but it doesn't reliably shrink large ovarian cysts that are already there. So in short, Some cysts can go away on their own, but for others, either monitoring it or doing surgery may be the safest and most effective way of treating it. And the best plan depends on the type of cyst that you have, your age, your symptoms, and whether you're trying for a baby as well. So what are the different types of surgery? Well, most ovarian cystectomies are performed using a minimally invasive or a keyhole surgery approach, also called laparoscopic surgery, and more recently, robotic surgery. So this is where we make some small incisions in the abdomen and a camera is inserted which we use to guide our instruments around. The cyst is then gently removed and the ovary is carefully inspected afterwards. We stop any bleeding and then we may close the ovary or leave it open after. The cyst itself might then be placed into a small protective bag and then it can be removed through one of the small cuts that have already been made. Sometimes the fluid needs to be drained before or it comes out with the fluid intact. In some cases, robotic assisted keyhole surgery may be offered to you. This allows for extremely precise movements and it can be helpful if there's a tricky cyst or a deep-seated cyst. It's not available everywhere, but where it is, it offers similar benefits to laparoscopic surgery with smaller incisions, hopefully less pain and a quicker recovery. Rarely, an open procedure, so a laparotomy, may be needed. Usually involves a larger cut through the lower abdomen and it's typically only done either if the cyst is very large or if there is a concern that the cyst could be cancerous or that there might be complications that make laparoscopic surgery not a good idea. So what happens before and during your surgery? Well, I do have a dedicated video about what you can expect from a laparoscopy. But if you're having this done for an ovarian cyst, here's the specific advice for your surgery. Before surgery, you'll usually have some routine checks, like blood tests. They might be checking for a marker called CA125 to give us more information about the cyst. You might have some imaging, like an ultrasound or an MRI scan. And you may be given a chance to speak to somebody about the anaesthetic. They'll also tell you when you should stop eating or drinking. It's usually the night before, and you should have a chance to ask all your questions and give informed consent. On the day of the surgery, you'll be under general anaesthetic. So you'll be completely asleep, you shouldn't feel any pain, and the procedure itself usually lasts around 60 to 90 minutes if that's the only operation we're doing for you that day. But that will also depend on the size and the location of the cyst and any scar tissue. During surgery, your surgeon may take a small sample of the fluid or they may take the cyst wall out and send that to the lab to double check that it is benign. Most people are able to go home the same day or the next morning. Sometimes we place a uterine manipulator. We place that through the vagina and that allows us to move the uterus around, improving the access to the ovaries and improving the vision around that area. But it might mean you could wake up with a bit of discomfort in the vagina. If you prefer this not to be done, then you can discuss it with your operating team before the procedure. The skin of the abdomen is usually closed using absorbable stitches or some skin glue or even just steri-strip plasters. So what does recovery look like? Well, with laparoscopic or robotic cystectomy, the recovery is usually smooth. You might feel a bit groggy for a day or two from the anaesthetic. You might have some bloating or even some shoulder tip pain from the gas that's used to inflate your abdomen. These usually settle quickly as the gas passes out. You might notice that you have some light bleeding from the vagina for a few days as well, but you can usually return to any desk-based work within 1 to 2 weeks. You can resume some light exercise after a couple of weeks, and you should expect to feel fully back to yourself by around 4 to 6 weeks. If you've had open surgery, then recovery will take longer, around 6 to 8 weeks, and you'll need to avoid heavy lifting during that time. Your first period after surgery might be a bit interrupted. It could come earlier, it could come later than you expect, and it may be heavier or more uncomfortable than usual, but this should usually settle out by the next cycle. When can you try to get pregnant after an ovarian cystectomy? Well, most doctors will recommend waiting at least 1 to 2 months before trying to conceive again to allow your ovary to heal fully. If the cyst was affecting your fertility, like in conditions like endometriosis, removing the cyst might actually improve your chances of falling pregnant. But your doctor can give you personalised advice based on your own specific case. So, an ovarian cystectomy can feel like a big deal, but in most cases, it is a routine and straightforward procedure with a good recovery. If you've been dealing with pain or uncertainty around the operation, please know that you're not alone. These are common procedures that are done. And if this video has helped you to feel more prepared, do give it a like or share it with someone else who might benefit from it too. If you have had an ovarian cystectomy in the past and you have any recovery tips for us, please do share those experiences below. Thanks for watching and see you in the next one.